Okay, I'm here with Steve Flanagan, who's the head of the Conservative Society for Action here on Long Island. Steve, what's going on here today at the front of Chuck Schumer's office?
Well, it's quite interesting. I think a lot of angry taxpayers came out today and said they're sick and tired of the federal government trying to impose upon their freedoms. Their most recent target now is nationalizing the healthcare system. The healthcare system in this country is responsible for 18% of the gross domestic product. The federal government is using the bogus issue of insurance and uninsureds to try and sit here and take control of 18% of the gross domestic product. If you sit here and combine that with the other moves by the federal government in recent months, starting with the federal stimulus packages, the bailing out of the financial system, they want to nationalize the financial industry. Then they turn to big industry and the auto industry. So they want to nationalize the auto industry. Then they turn to cap and trade and the energy industry. They want to take control of these industries in the name of what? What? It's certainly not freedom. It's certainly not giving people a choice. It's certainly not in the name of the free enterprise system. Now when you add in the nationalization of the healthcare system, add it up, and the federal government in the last 6 months has made proposals to control 85% of the gross domestic product of this country. No matter how you define that, that is socialism. That's the central control of our country by a government in Washington through the use of czars. And when they come to the healthcare system, they're going to appoint another czar. This country has prided itself on freedom. Groups are opposed to a government, or actually anybody, coming between a doctor and a patient. The so-called choice movement, the freedom of choice movement and all that, all right? Well, in the women's movement, they say that they don't want anybody coming between them and their doctor. It's a private issue. It's my body. It's my doctor. You have no right being in that. But these same people want to institute a nationalized healthcare system to become between me and the doctor, and between the doctor and these people that are here today. That is socialism. That is not freedom. We have to fight these people. And the people that came out here today came out here with about 4 or 5 hours notice because they found out that they were going to have a chance to make a difference and to fight a nationalized health care. That's why we're here today, and I'm very proud of the people that came here today because we're mad and we're not going to take it, and we will be silent no more.
What about the government's argument about reining in the escalating costs of HMOs will wind up saving us money? What do you think about that argument?
Well, they have an easy way of doing that. They're just going to have their own, they call it a competitive medical program. Well, it's not really going to be competitive. They're sitting here. We talked to some of the activists today who are in favor of the healthcare system that say, oh, we're just going to have a federal healthcare program to compete with the private companies. And that's going to reduce overhead. It's going to do all this. Well, no, it's not. It's going to create a different set of overhead. Instead of an individual company paying the overhead, the federal government is going to pay for the overhead. So what's going to happen is, okay, fine, you can keep your insurance company, but you can't because your insurance company cannot compete with an insurance competitor that's financed by the federal government. It simply can't happen. And you're not talking about reducing costs. You're reducing a cost to that particular insurance provider, a government insurance provider, but the taxpayer is going to pick up the difference. So there's no reduction in cost. It's just a transferring of the cost from an individual or a company over to the taxpayer. And we are not in favor of that. We feel that the free enterprise system is the best system in the world. It's worked fine. Nobody's dying in the streets that I know of. I asked these people over here who are in favor of nationalizing health care, and their biggest fear is that people are going to die in the streets. I asked them to show me one. Tell me if they've heard of one. Give me an urban legend, have you heard of one? Nobody in this country is denied health care, whether they're an American citizen or an immigrant or an illegal alien. When you walk in for health care in a hospital, you will not be denied. They ask you one question. Do you have insurance? Do you not have insurance? If you click no, I don't have insurance, you're covered absolutely free. You get coverage, follow-up care, and drugs. We do not have a health care crisis in this country. It is a bogus argument, and we know it. The people out of here today know it, and we're going to do everything we can to fight that.
Are you surprised that Chuck Schumer isn't here to hear the opposition?
I'm not really surprised at all. Chuck Schumer is going to hear some opposition, but he's not going to be at an event like this. Matter of fact, I'm sure he was not expecting any of us to be here. He thought that MoveOn.org was going to come up and give him a little rubber stamp and a pat on the back. Thank you very much. Well, things are different. The political landscape in this country has changed. There are people like us, there are organizations like us, and this is just the beginning. This is just the start. We're going to put an end to this folly, which is nationalized health care. We're going to put an end to the energy tax and the cap and trade legislation that's going to destroy businesses and jobs. And if we can put an end to these things, we can put an end to this recession. Businesses and the free enterprise system in this country right now is waiting for answers to these big questions. What is the cost implication going to be for healthcare? What is the cost implication going to be on energy? How does a company make a 12-month or a 24-month or a 5-year plan without knowing what those costs are? As soon as we defeat these two massive piece spending at the federal level, healthcare and cap and trade, we will come out of recession because business will be encouraged that the free enterprise system is alive and well. And the only way for us to come out of recession is for the free enterprise system to do what it's always done, which is come back from recession with years of profitability and prosperity. The federal government cannot do this. They tried it in the 40s. They took a normal recession and turned it into a depression of government interference. This administration today is trying to do the same thing. We have to stop them, and that's why these people are here today.
Very good. Do you have you disagree with what he's saying, ma'am? Okay. Would you mind stepping next thing and have a debate?
I'd like you to just listen. Where were you the last 8 years during the Bush administration? And also, why do you think that with your democratic process, when 73% of the population of our country are supporting a public option for health? And why do you think it's okay that our Congress has health insurance available to anybody else? If there's such a problem with going forward with this, then why don't they strip themselves of that health insurance? Why aren't they personally, privately paying for their health insurance?
I agree. I think they should.
I do too.
I don't think Congress should have anything more than any other member of society.
Agreed.
They're not entitled to anything. Bush administration?
Yes.
Well, guess what? The Bush administration and no president of the United States has the authority to spend $1. That power and that authority comes from the Congress of the United States. I'm not here to fight Obama, and I'm not here to talk about Bush. I'm here to fight the Congress of the United States. And the Congress of the United States, under past presidents, whether it's Bush, Clinton, or Bush 1 or any other, are the culprits, and they're the ones who are guilty. We're not here to fight Obama. We're here to fight the Congress of the United States.
Okay, I actually agree with you, and it is pathetic that throughout more than the last 10 years, Congress has not done its responsible job, and the incumbency is being taken care of by Big Pharma and by the health insurance industry, and the very fact that they are spineless to stand up for fiscal responsibility under all Republican administrations, it doesn't matter, is really a sad commentary. The people in Iran and the people in other countries have a lot more gumption than we do to come out in the street and say, this small d democracy, we stand for something else, you do not represent us, and we protest. So
I agree 100%. I agree 100%. Basically, our philosophy and our organization is throw the bums out. I don't know very many good incumbents. Democrat, Republican, conservative, or liberal. It doesn't matter. What happens to these people and these representatives if they go to Washington and they become part of the Washington establishment? They stop being representatives for the people.
Agreed.
We have representatives here. They're supposed to be representing us.
That's right.
These people go down to Washington and they are indoctrinated by their political parties, by their political action, and they become part of a country club atmosphere,
exactly.
And they don't know what's happening in the streets. Whether or not you and I agree on the issue of nationalized health care, I 100% agree with you that these people have to be thrown out of office. We need a people's house. We need a people's house of representatives so that debates like this can go on and these people are listening instead of being up there someplace or being someplace else.
No, and we need to clean up public campaign financing, because as long as the lobbyists take care of keeping the incumbency, the incumbents, they don't ever have to listen to us.
Absolutely.
We are whistling in the wind, and it's very sad.
I agree.
It makes me angry about our country, and I'm a teacher, and I have a hard time teaching 4th graders or 8th graders about the Constitution and checks and balances when in fact we rarely live it. It is the exception.
Absolutely.
We talk about exceptional Americanism. That is the exception to the rule when we actually follow what has been designated.
100%. Thank you very much. Thank you for being here.
Don't you wish Congress can get along that well, the way they just did, and argue things respectfully?